Hello, everyone, and welcome to the first BHM live stream, first Black Health Matters live stream, I should say. Tonight, we are going to be discussing COVID, vaccines, and the impact it's had on Black communities. So, just first, a bit about what Black Health Matters is. So, the Black Health Matters project is a project funded by the National Lottery Fund to address health inequalities within Black communities. There's health inequalities within Black communities, and there's a number of different health issues. The first one that we're tackling will be COVID-19 and the COVID pandemic. This project sits under the Love Tank CIC. We are a year from the beginning of the COVID-19 pandemic in the UK, and we've seen a disproportionate impact on Black and Brown communities, regardless of the age, occupation, or impact, or geographical location. This evening, we have an incredible panel to reflect on the past year, what we've learned, where we are now, and how, and as we look to the end of lockdown, what the future is going to be looking like. Tonight, we'll be discussing this with all the panelists, and there will be an opportunity at the end for audience questions. So please feel free to post your questions in the comment section and throughout the event. Mark and Phil will be in the background doing tech tonight and moderating in the evening. So I'd like to now start introducing our guests. Our first guest tonight is Professor Kevin Fenton. We also have Dr. Rageshri Dhairyawan and Lisa Agyen. Thank you all for joining. Great. So Kevin, would you like to introduce yourself, please?
Thank you, Dale, and hello, everyone. It's really such a pleasure to be here with you today. So I'm Kevin Fenton. I'm the Regional Public Health Director for London, and I've been in this role just over a year. So I've had the privilege of leading the public health response to the COVID-19 pandemic in our city here in London, and have worked closely with partners in the NHS, in local authorities, national government on the response. This evening, I'm doing this recording from home. I'm actually in a suit with a pink shirt, and I am a Black male of Caribbean heritage. And so looking forward to the conversation this evening.
Dr. Rageshri, could you introduce yourself?
Hi, Dale. Hi, thank you so much for inviting me, and hello everyone. I'm Raghav Darwan, and I'm a doctor and researcher. I'm a consultant in sexual health and HIV based at Barts Health in East London, and I live and work in Whitechapel. And with regards to COVID, I've been looking after COVID patients and been involved with some research and policy regarding COVID. I am an Asian female with a short boy's haircut, sitting with quite a colourful top on, sitting in quite a disorganised studied bookshelf behind me. So very nice to meet you all, and I look forward to the conversation.
Thank you. And Lisa?
Hi everyone. It's an honour to be on this panel. I've got no medical qualifications, I should start with saying. Just an ordinary person, but I've been living with long COVID since infection in March 2020 last year. After repeated poor experiences trying to gain support and care, I started to become active in a long COVID Facebook support group in last autumn 2020, and since then I've been involved in co-authoring an article in the Lancet in response to the NICE guidelines on long COVID. I also joined the NHS Long COVID Task Force, so I've been joining their meetings as a patient representative, and I've also produced a survey that's live at the moment to record the experience and ability of people with long COVID to access the long COVID clinics in England. Currently, I'm a program manager in the civil service when I'm able to work, and I've worked in the civil service for nearly 20 years now on government programs and with ministers. And I'm definitely a kind of hands-on kind of person, so that's the reason why I've got involved. I'm of Ghanaian heritage, Black female of Ghanaian heritage. I live in South London, Purley, with my husband and 3 children. Thankfully, they're all out playing football, so I shouldn't be interrupted. And I've got braids, I'm wearing a grey top, and I'm in a room with a white background and a colourful art picture in the background. Pleasure to be here.
Thank you. And before I forget, I should do my audio description. I am a black male with locks. I am wearing a black and brown striped shirt and against a white background. So now let's get into the questions. First, I want to ask you all a question about how COVID has impacted you, both personally and professionally. This is particularly the reason why I want to ask this, because Black Health Matters, what we try to do here is bring together people of lived experience on a number of different issues. So, so how has COVID impacted you personally and professionally? Anyone feel free.
Shall I jump in first?
Go for it.
Okay. So I guess from a personal point of view, I think I feel quite grateful and lucky that this far into the pandemic, you know, I've been lucky to still feel healthy, to not have COVID significantly impact on my close family and friends. I think for that, I feel very grateful. I think from a professional point of view, it's been difficult as a hospital doctor. I think, you know, it started to happen very suddenly. And then, you know, at the beginning of the first wave, we were when we were not in our usual place. We weren't in our usual office or our usual clinic. We were being redeployed to work with COVID patients, or colleagues were shielding. So it was it was all very new, and at the beginning quite scary when we didn't know much about the disease or what worked to treat it or what we could do to prevent it. So I think the first wave experience was in a way all very new. I think on the ground we saw the impact of how research in real time can be effective. So we were recruiting patients to studies to show what works in terms of cure. And then I think the second wave, which was bigger, was also, I think it was different in many ways. It came across us so suddenly. It was so big. Once again, I think it's felt quite tiring. I think it's felt as a healthcare professional, we feel like we have been through something together. And I think we all know people who have had COVID. And I think personally for me in my department, we've had a couple of people who have died from COVID, which has been very sad. So I think in many ways, you know, it's been a very emotional time, but I do feel, you know, hopeful with vaccination that we are getting through this. So it's certainly a year like no other.
Yeah, I have to say I completely agree with you. Actually, it's been a tough year. You know, as a public health person and as an epidemiologist, the person who studies epidemics and works with governments to control them. In a sense, this has been professionally what we train to do and what we're trained to respond to. So the pandemic has been a time of sort of professional growth development. But then it has required many long hours working with many partners on first an infection that we didn't know much about, control measures that we weren't sure would work, the impact of the lockdown, the direct impact of COVID, and of course the indirect impacts on COVID, on mental health, on long COVID, on other conditions. So as the year has progressed, even although we were well trained and prepared for an event such as this, it is very unusual that we be involved in a pandemic of this size and scale and impact. And so it has been professionally a very challenging time. And I think personally, it's been difficult as well. So I haven't been able to travel to see my family in the Caribbean, in Jamaica, now for coming on 2 years. And, you know, having elderly parents and not being able to see them, let alone hug them, because of this global pandemic and its impact, just says that there's a commonality of that experience, of the emotional toll that it's taken on our well-being, on our physical well-being, that I think we all have to acknowledge. So we'll have a chance to, I'm sure, on the conversation to reflect on what we've all had to do to survive. You know, let me tell you, wherever you are in this, and whoever you are, whatever your background, we all have been affected, although we know that some of us have been more affected than others. And I think the conversation today is going to be an important time for us to reflect on that, but also say what lessons have we learned and how we're going to do things differently emerging from this.
And Julie,
for myself, it's had an impact on me, very much an impact personally, but also professionally, if I think about it. When I got ill really early on, before there was cases in the UK, so when I initially sounded the alarm bells, I was told that because I hadn't travelled to Italy, I couldn't have COVID, and for me, that's been the beginning of my battle to kind of to say, you know, something is wrong with me. So from a personal perspective, it really has been like not just battling the illness, but battling the medical establishment around it. I know it's because it's new, so I'm not blaming individuals. It's just, it was a new thing. And then it's affected my lifestyle in that I'm not able to plan to do things. And professionally, I had to resign from my job basically, because I knew I just couldn't do it anymore, and make a constructive choice to go for a lower paid job, less hours, so I was getting a lower income, taking myself back maybe 10 years worth of my income, just because I knew I'm going to have to deal with this chronic illness. So it has impacted my personal life and my professional life quite a lot in the last year, but thankfully I haven't lost any relatives or had any relatives that have succumbed. In fact, I'm probably the only person in my family that had been, you know, damaged to a certain extent by COVID. So I'm thankful for that.
Yeah, it's been a really, really difficult past year for all of us in a number of different ways. I myself have long COVID and I'm dealing with it as well after getting COVID back in February of this year. So, as I said, it's been a whole year since we've been in the pandemic now in the UK. So, Kevin, could you tell me a bit about what we've learned in terms of COVID and the impact it's had on Black and Brown communities?
Sure. So, you know, what a year of learning it's been, right? So from the first reported cases, which happened towards the end of 2019, of an unknown respiratory illness in China, to having a name for the disease, beginning to think through control measures, going through now at least 2 major lockdowns in some parts of the country, 3 or more lockdowns to help to control the infection. And of course, over the course of the year, having tremendous advances in science, in understanding both how the virus is transmitted, how to control it, and then of course, developing technologies to test, contact trace, and of course the vaccine, which has just been an incredible experience in the past a year and a bit. But I think year and a half. But when I reflect on the impact, what we now learn and what we now know about COVID and its impact on Black, Asian, and minority ethnic communities in our country, I think we've learned a few things, and I'm just going to kickstart the discussion today. There are 3 things which I think are etched into our hearts and into our minds, having experiences. The first is that this was no great leveler of an infection. It really disproportionately affected people who were older. At the beginning, men more than women. It affected people who were living in urban settings, much more deprived parts of the country than less deprived parts of the country. And we now know that it has had a disproportionate impact on Black and minority ethnic communities in our country as well. And, you know, we all go back to the memories of the early reports on TV and seeing Black healthcare professionals who were dying from the disease, and then the studies which came out which showed that. The second key lesson, I think, is that it's not the color of our skin that drives this increased risk of disease, but we know that there are factors related to how we get exposed to the infection by the jobs that we do, by the networks that we have in the community, by the household and living conditions we have. And that if we are infected because of multiple long-term conditions that we may have in our community, we're much more likely to have severe disease and poor outcomes, including death. And then the third thing that I think we've learned is that, you know, the inequality in COVID is very much like the inequalities that we see with HIV, with tuberculosis, with other infectious diseases. And it means that the tools to addressing this, we know how to do this, right? And it has to begin with empowering communities, with engaging communities, with building capacity in community to respond. It has to do with ensuring that people have the tools that they need to protect themselves and their communities. And it means that the system, the healthcare system and the public health system, social care system, need to be culturally competent in what we're doing so that we're providing services in ways that are meaningful to communities to support them to protect themselves and their loved ones. So just to start the conversation today, I think those are 3 things for me that I'm taking away as lessons from this year.
Thank you, Kevin. Just to note, Dr. Rageshri had an internet issue and she's dropped out. She'll be coming back soon. Just to continue on for that same question, Kevin, were you surprised by, I think you've kind of touched on this already, but were you just surprised at all by the impact COVID had on ethnic minority communities?
I wasn't surprised, again, because of the work that I've done in public health and epidemiology. So this isn't my first pandemic. I started my career working in HIV back in the 1990s. And so that experience of understanding how diseases spread and how they become concentrated in subsections of the population, especially people who have poor access to healthcare services, people who may be having other health conditions that place them at risk. We've seen that with other infectious diseases. So I think we had expected to see that difference, and we had been warning to look out for it. But I think what took us all by surprise is just how quickly that difference manifested, right? Within months of the pandemic arriving on our shore, we began to see these differences appearing. We began to see the impact on hospital wards, in Nightingale wards in the country, where you saw Black and brown people being disproportionately affected. And I think that starkness of the impact was a wake-up call for policymakers, for people in the community at that time. And when we did some of the early work on this, the stories that we got back from communities on the challenges that they had and why they were disproportionately affected, I think are stories which will stay with me forever, because it was so impactful at that time in that first wave when we were doing the work.
Yeah.
I've got a question just on that. I think when it all kicked off and we started to recognise that Black people were being disproportionately affected, I was like, I'm sitting in my sick bed, like Googling like crazy. Why? Is it because of the genetics, or is it because we're being exposed? I think it's come out now that it's more that we're being exposed, because I was thinking, well, they kept on saying when it goes to Africa, it's going to be terrible. When it goes to Africa and Caribbean, it's going to be terrible. They can't deal with it. And then, they got the cases and they were actually able to deal with it. So I was trying to look into, are the Black communities in Spain, in Germany, are they being disproportionately affected too? Or is it just in the UK and the US? I still don't know the answer to that question. So I'd really like to know, because I know it's not a genetic thing now. It's not because of our makeup, but, COVID doesn't know how much we earn. So how?
Well, it's a great question, and I know Rageshri will have thoughts on this as well. One of the things we saw really early was that depending on the job you do, and depending on whether you are in direct contact with people who may be infected with COVID, or if you're in jobs which have you in contact with lots of members of the population, so security guards, taxi drivers, people working in public transportation, those two factors were likely to drive your increased risk of being exposed to the infection and to become infected. And that's why in wave one, we saw that really particular pattern of people who were in sort of key worker occupations who were disproportionately affected. As the epidemic, I think, has moved on, we've seen other exposure factors which have become important. And again, from a clinical perspective, that impact on not just getting infected, but why people have severe disease, I think that became apparent as well over the course of the year.
Just to capture you up, Dr. Rageshri, the question was on, were you surprised by a disproportionate impact of COVID on ethnic minority communities?
Sorry about that, my internet skipped out. I think I wasn't surprised at all. I think when we look at healthcare disparities in many other disease areas, we see the same patterns, and particularly in infectious diseases. So in my particular field of sexual health and HIV, we also know that some ethnic minorities are disproportionately affected by those. So I think it wasn't really a surprise at all. But I think, it took a while to work that out. And as Professor Fenton said, it's about exposure and who is more likely to be in those occupations where they're more likely to be exposed, who's more likely to be living in housing that may be overcrowded. So again, being less likely to self-isolate, and thinking about who has worse health outcomes. We learned that it was people who tended to have conditions like diabetes, for example. And again, diabetes is seen more prevalently in some Black and Asian communities. So it wasn't really a surprise when that came about.
Mm-hmm. And what has that, as you said, we both said it's been affecting people more that are on the ground that work directly with patients and stuff. You work with patients. What does that look like for you on the ground?
I think it's been quite difficult being a person of colour myself to see people that look like me and many of my colleagues on the wards. And I work at the Royal London, and we were kind of the surge centre for our trust. We have 5 different hospitals, but we try to centralise the COVID patients at the Royal London, and we created 500 more intensive care beds. So we had 500 extra patients in intensive care with the second wave to deal with this, and we only just closed that surge capacity yesterday. So seeing that on the ground was actually, it was very heartbreaking, and it was very different treating patients, because normally patients get visitors, you know, we're able to talk to them fairly easily, but when you're wearing lots of PPE or personal protective equipment, it's really hard to communicate. So for example, it's hard to show that you're smiling when you're wearing a mask or a visor. So I think for me as a healthcare professional, it's been difficult to try and show the usual empathy in the usual way that we can with patients, and these are patients who are on their own in hospital without visitors. So I think in many ways that's been tough. And I think some of the issues around language has been difficult as well. So if you've got someone who can't speak English, and we did have many patients that couldn't, you know, how do we communicate with them? We can't have an interpreter in the room, for example. So it's been very different on the ground, I think.
And Lisa, as you mentioned at the beginning, you are dealing with long COVID now. Could you tell us a bit about what that is exactly?
Okay, so long COVID is now classed as when you've been ill for following acute illness with COVID. So it could be just that you've caught it, you've been infected. If you're not recovering after like 4 to 6 weeks, then they start. There's like a middle period where they may then consider you for long COVID. But generally speaking, with the guidelines, it's over 12 weeks when they say that you can be definitely diagnosed with long COVID. And it's just when you're experiencing symptoms of COVID, or a wild, very varied list of symptoms. I think it's up to 200 or just over 200 at the last count of the various symptoms that people have experienced that can be attributed to long COVID. But yeah, the main thing with these varied symptoms that different people experiences in different blocks is that there's a relapse and remitting nature to it. So you may well then feel better after, 3 weeks of feeling quite rubbish, and then feel better, you get back to usual, get back to doing your day-to-day routine, and then you crash again, and then you relapse. So that's one of the main features that I would say that then causes it to be investigated as long COVID. Also with long COVID, it's quite difficult for the medical professionals to be able to put a finger on necessarily what is causing you with those symptoms. So for example, a lot of the normal blood work and the normal tests that are available for GPs or secondary health, they may come back clear with long COVID, but it's just not clear exactly how the virus affects the different organs in the body. But there have been some cases, especially now with people like my cohort who got sick of the first wave, who are now finding that they've got organ damage in various parts of their body. It could be to do with the gut, it could be myocarditis with their heart, or they could have a high heart rate. There's just it's starting to come out now, but there's a lot about it that we just don't know.
Yeah, absolutely. And as a Black woman, has it had any particular impact on you personally, professionally, or with friends and family?
I think with my background, my race coming into it, I don't know. I feel like I've been affected, but the main thing for me was finding other people that were like me. That was really, really hard, and that was so key in my recovery, and that was quite hard to do. So that was irrespective if I was Black or white or whatever ethnicity. I think once I realised what was happening with me and that there were other people like me, I wanted to find other Black people like me as well. I mean, like birds of a feather and all of that. So that was the bit that I found most difficult. I think when I think about it, and I've been thinking about it a lot recently, I think culturally, we don't really talk about illnesses, especially I'm West African Ghanaian, and we don't really talk about the specifics of illnesses in our family. We will say such and such is sick, or my aunt might have cancer, for example, and be having chemotherapy, and they'll just say, "Oh, did you know your aunt is sick and she's having medication?" Like they won't actually give you the specifics of what's happened to this person. So it was quite difficult for me to broach it with some members of my family. I mean, obviously I was scared to tell them because I didn't want to worry them, specifically my mum. But there was a bit of, we don't really talk about our health out loud, for me anyway, for my family. And then also culturally, like when I did try to explain to my mum, I was like, look, don't worry, have this concoction of leaves and this, and I've got this from Ghana, have this, you'll be fine. Boil the pineapples and you'll be fine. And lemon every day, it'll go away. Don't worry, we'll pray for you, you'll be fine. So there's always that kind of, everything will be fine, take this, don't have to go to the doctors, don't go to the hospitals, just take this, what we've had culturally. And part of me wanted to try it, I was like, I'll take anything, I will try anything. I was drinking this G-Power supplement from Ghana that was imported. It was like £25 a bottle. It was really expensive, but it was just made out of pure like tropical leaves. And I googled everything that was on the ingredients because the active ingredients was tropical leaves. So I googled all of the leaves and found out they were all good and known to heal certain conditions. So yeah, why not try it? But that was one thing that culturally I felt like I had a bit of guidance on that side. I could try both ways. I didn't have to just rely on the medical route. So in that respect, I think that was a positive for me.
And in regards to getting support and treatment with long COVID, you said your home members and stuff, were those sort of encouraged when you went to doctors?
No, they didn't really know what to do. And so in many cases, I'm trying my own stuff. And, we might be sharing it with other people on the social media groups. So have you tried this? Have you tried that? I've heard this works, and we'll just try it. But I just felt like having the back. I mean, I ended up sending some of this concoction to a white lady that lived in Cheshire, who, I befriended on these groups. She was happy to have another alternative to just try something. So in some respects, I'm glad that I brought some of my cultural background with me into this journey. But I think what I found the hardest, and I joined the NHS long COVID task force specifically because it wasn't diverse and it was just a group full of middle-aged white women, albeit they were suffering long COVID too, but they weren't speaking for me, or they weren't speaking for people in my community or people that I was thinking about that don't necessarily read The Guardian or have the Zoe app, which was the app that was promoted most highly for people with long COVID. I just felt like, how can we get this message off The Guardian, for example, and into our real communities, people that don't use Facebook, don't use Twitter, and they may well be sick like me, like I was, but they just won't get the message. And then, they might tell their mum they're not feeling sick, and their mum will say to somebody else, oh, such and such, she's just feeling sick, and not actually say about this long COVID, because culturally we don't say what it is. So yeah, that was one way I think it linked.
And Dale, just to support what Lisa has said, one of my concerns is because Black and Asian communities were disproportionately affected in wave 1 and wave 2, we can expect to see perhaps more long COVID. We may well see more long COVID in minority communities. So I think the work that you're doing, Lisa, is so important because people may have acquired the infection and may be having the symptoms, but are not sort of aware of long COVID, not sort of confident to approach your GP, and not assertive in saying, actually, I think something's wrong and I'm going to persist, as you did, in getting this sort of treatment. So I think there's a lot of work that we have to do to ensure that our communities aren't further left behind as we emerge from the pandemic with a new pandemic of mental health issues and long COVID that we're not able to get our community mobilized around. So really, really good work, Lisa.
And as on what you were just saying, Kevin, about ensuring our communities actually accessing the support we need, how do we go about doing that in regards to both COVID and long COVID?
Yeah, I think the year has taught us that, as I said earlier, that engagement and mobilization of communities are the key, right? It's key to ensure that our communities get tested. It's key to ensure that we participate in contact tracing. And it is certainly key to ensuring that we get engaged in the vaccine, and we tackle vaccine hesitancy head on, and that we get good vaccine coverage in our communities. So I come from the train of thought that actually this is not about services doing things to communities, but communities recognizing that this is a health threat and a health crisis that faces our community, and we need to work together with the system to ensure that we address it. So 3 things I think will be important. One is information is power. I can't stress that enough, and it's not information from internet sites on the dark web or WhatsApp memes. It's about being informed, getting the facts, asking your physician, going to trusted sources and getting the information on COVID and long COVID, and making an informed decision about your health and how to protect it. Second, I have to talk about the vaccines, because if it's one thing we all can do to protect ourselves and our communities, is getting vaccinated. It is the most powerful tool we have, Dale. And I want to ensure that, again, our community doesn't get left behind as the vaccines get rolled out. The data are showing that Black African, Black Caribbean communities are lagging behind other communities. So we need to ensure that we're taking up this really, really effective tool. And then finally, as we emerge from the pandemic, the legacy of COVID is going to be with us for years. The mental health impacts, the impact on our young people, the impacts on all the people who have chronic diseases that haven't been treated over the past 12 months, 18 months, cancers, heart disease, diabetes, etc. So our community has to get back on track. And so, working with GPs, NHS colleagues, local authorities, we have to do that, not only mobilization, but ensuring that as we restart services, we do that with equity, health inequalities at the forefront, and we design our services to reach the hardest to reach from the beginning, not as an afterthought or at the end. We have to design our services now to reach those who are in greatest need. And I know the NHS has this as its mission. So 3 things there I think are really key.
Rageshri, is there anything you think we can do as well to ensure that Black and brown communities are getting the treatment they need for COVID and long COVID?
So I agree with everything that Kevin's just said. And I think what is really fantastic is that even just before COVID, the NHS were setting up a new organisation called the Race and Health Observatory, which I believe Kevin is a part of, which is looking specifically at health inequalities with racialised communities. So that was kind of underway, and that focus was starting to be looked on. And of course, COVID is just reinvigorated that even further. I always thinking about on an individual level in terms of persisting. I think sometimes as clinicians, we are not brilliant at listening all the time, or as well as we think we are. And that can be made worse if we're busy, for example, or, many different priorities. And I think the thing about persisting is important, but not being, but don't be afraid to bring other people into this. So I think when Lisa mentioned about other people who were like her, so meeting other people who had long COVID, there's something about that, about advocating for each other. So often with my patients in my HIV clinic, for example, I will encourage them, if they want to bring someone with them. I know that's more difficult during these COVID times and with work appointments, but don't be afraid to bring someone with you who can talk about things that you may not be able to say in the appointment, or have forgotten, or to write a list before you come in. All those things can help when you're kind of in front of your clinician. And as a patient myself, I've been in front of a clinician and everything's left my head of what I wanted to say. So having it written down, for example, is important. So those are the kind of things that we can do to advocate for each other and for ourselves as well. Yeah,
thank you. And I think you touched on this as you were on your last response, Kevin, about vaccine hesitancy. But why do you think this is? This is a question for you.
Yeah, it's we've been doing so much work on it collaboratively over the past 6 months. Actually, we started, I think, in the autumn last year, preparing the way for the vaccine. And many reasons, right? So historic mistrust of services that plays itself out in people not wanting to engage, not trusting the system, or mistrust of drug companies based upon previous behaviors and history of vaccination, especially in other countries as well. There are issues related to people just are not sure about the content of the vaccine, the safety of the vaccine, how it's manufactured, does it contain any port materials or any materials from aborted fetuses? Some of the basic questions about content and effectiveness of the vaccine. And then there's an element of hesitancy, which is around people are just not able to access the services in ways that are that work for them. Right, so you think that by setting up a vaccination centre at the Excel Centre in Newham would work for everybody in London? Well, actually, think about it. It means that you have to have the resources to take public transportation, the wherewithal to get to the vaccination site, book your appointment online and get it. And if you have to register to get your NHS number to get your vaccine, what may not seem as barriers to many of us are actually many barriers in the way of getting a vaccine for many of our communities. So a key part of hesitancy is also thinking of the institutional barriers which exist that prevent people from being confident in getting the vaccine. So we're learning a lot about it. And the good news is, Dale, that day on day, hesitancy is going down, and vaccine uptake is going up. But what I want to see is that uptake going up faster, because as we are unlocking and returning to mixing in the community, and everybody's looking forward to getting back to the pubs and bars and clubs and so forth, we need to do that as well protected as we can be. And there are too many parts of our city where we have low vaccination rates, and there's a real possibility that as people begin mixing more, we're going to see a return of infection. So it's really important that if you're invited for a vaccine, to please take it, because it's such an important part of it. But it's important that we listen to people's concerns and address those concerns as well. So hesitancy is meaningful, and we need to address that too.
I think if I can just jump in there, I think I find exactly the same. Like I've had, me personally, I've had COVID, so I'm like, vaccine, please put it in me. I'll take it. But I know a lot more, and I'm a lot more invested in it. However, for even my own husband, he's due to have he's supposed to have had it today, and I know he was really hesitant right up into the last minute of whether he was going to take it, because he didn't want to take it, even though he knows what COVID has done for me. So I think the point that I would like to echo for you, Kevin, is I think you've done a lot of work going around and talking to communities, and I think you was at my workplace done an online session with you. So it's really kind of like good. People can go and find out facts. When I've asked people in my Facebook groups of professional young Black women, it's been a split of, yeah, I'll have it and I've got no problem taking it. And other people these are educated people, they're not uneducated. Educated people are saying, actually, I'm really hesitant. I'm not sure. It's not been around for long enough. And, I don't trust Big Pharma, and I'll wait for next year. Actually, I'm not planning on going on holiday, so I'll just chill and wait. I don't think I'm high risk. Those are the things that they're having. And when I was kind of reading through all the responses I was getting to my questions, a lot of the thing that I was thinking was that this is not necessarily just a Black thing. Some of the reasons they were giving back to me were not just because they were Black, they just had hesitancy. So it was like, I really feel like there should be a space for people, all peoples, to be able to bring their hesitancy questions up and talk about it without having to feel like they're some kind of conspiracy theorist or something like that, so that they can get the facts. It was an easy choice for me. I made the facts because I read the facts and I made the decision. But some people who are not so invested might hear something on WhatsApp from a friend, or just hear the headlines of, there's only been 48% of Black people that have got the vaccine, and there's 70% of white people that got the vaccine. So they'll be like, oh, it's only 48% of Black people. And they'll think, okay. And then it will kind of influence them in that way, rather than influence them to get it, if you see what I mean. Mm-hmm. That's what I picked up from some of the conversations that I've had with other people.
I think what you both said is a really key point about just actually talking about it, and talking about the fact that, being honest about the fact that, yeah, we've had COVID and we are dealing with some of us are dealing with long COVID. Just actually sharing our experiences. I think that kind of starts to work away at some people's hesitancy and I suppose their initial thought does not get the COVID vaccine. I found that amongst my own family and friends, just talking about it has start to dispel a lot of the myths that people have and like ideas about like whether it's got like a microchip in the vaccine or whatever. Just talking about having open, honest conversations is actually really helped to work away and encourage people to get the vaccine.
And I think it's not just about one conversation. It's often about having repeated conversations so that people have time to think, and then you can come back to it. So I think that's really important as well.
Yeah.
But one thing I have found is that a lot of the people who in the beginning were like, no way, I'm not going to get the vaccine, no way. When they were called up, they went and got it. They just didn't talk about it, you know?
Yeah.
There was quite a few people that did that. So a lot of the rhetoric in the community is, oh, no, I won't do it. But they privately just went and got it done, or their parents got it done, and no one talked about it. So it's that not talking about it thing again. But yeah, some people have had it, but just didn't want, they will hide behind the, I'm not taking it, it's not safe. But in their own personal life, they went and got it because they cared about, they thought it was the right thing to do.
Mm-hmm.
And I think as more people in our community get it and we normalize getting the vaccine, that's going to have a positive effect as well. We've seen this in the United States. We've seen it in other countries. And again, as you said, Lisa, it's not a black thing. If you're hesitant, the more coverage you have of the vaccine, the more people feel safe and the barriers to accessing it decrease. So I'm hoping that we will see that as well. There's also something really powerful about testimony. And Dale and Lisa, what you've done this evening to talk about your long COVID is so powerful, and I want to acknowledge that. And this is important for young people as well, because as the vaccine becomes available to people under 40 and then under 30, for young people, they may say, well, I don't need to get the vaccine because, I can get COVID. It's not going to be a problem. But I think your stories and your testimony today about how COVID has affected you as young people, is really important, that we all can be protected and we all can be affected. And we just don't know how the infection is going to affect us. So getting protected is key. I just wanted to thank you both for your stories tonight.
Sure.
Apologies. I just wanted to agree with Kevin and to say the other thing which I found useful recently is talking about how we're finding that the vaccine is affecting transmission. So I think you're less likely to pass it on. So kind of talking to people about how if you want life to go back to as near as normal as soon as possible as we can, the more people get vaccinated, the more more we can get back to normal life, hopefully. Yeah.
Just going on to the next question now. We've seen that COVID has had a really devastating impact in India, and there's been also concerns about outbreaks happening in Africa and in the Caribbean. How do you think this is impacting the diaspora in the UK, Rageshri?
For me, on a personal level, and kind of speaking to my family members here, it feels like a big weight on our shoulders. I think we're incredibly worried, and I think we feel quite helpless being stuck over here because we can't readily bring people over, we can't go there. We're just hearing news about what's happening, and I think also the fact that we are doing relatively very well here with our vaccine take up, things are opening up and things are going in the opposite direction. I almost feel a little bit of guilt about that, but I think what we can do is try to think about the positive things. So what we can do to improve kind of global access to vaccines, so campaigning for making sure everyone around the world has access to vaccines. We can also contribute to charitable funds. So for example, with India, there is BAPIO, which is the British Association of Physicians of Indian Origin. So Indian doctors in the UK who have, for example, put together a big charitable fund which people can donate to make sure that their supply is going over. And I also know, a lot of doctors, for example, Indian doctors are giving webinars and teaching sessions to doctors in India to teach them about what they've learned in the second wave in terms of better care. So I think it's difficult, but I think there's much that we can do. And I think trying to get access for everyone globally for vaccines is the way forward. So fingers crossed that happens.
Is there anything you'd like to add, Kevin?
I agree with Rageshri, and I think to bring it back home, I think seeing what's happening in India, looking at what's happening in Jamaica and in parts of the Caribbean where they've also had second wave infections as well and are going through lockdowns, it does reinforce not only our global responsibilities, but also for me the privilege that we have here of having access to the vaccine and as you said, Rageshri, to be reopening again. So, you know, when I had my vaccine, to be able to say to my family in the Caribbean, you know, I had the vaccine, everything's fine, get yours when you're offered, was so powerful for them. And it provided them with the reassurance. And they thought, gosh, you know, we can't wait to have that available. So there's something for me about recognizing with humility the privilege that we have here and to take full advantage so that we can also help others as well.
And just another question for you, Kevin. We know health inequalities across a number of areas that disproportionately impact Black and Brown communities in the UK. Like we know a lot of them. Is there anything that's worked on those particular issues that we can start applying to COVID and the vaccine uptake, such as the increase in HIV testing?
Yeah, no, absolutely. You know, and I think some of the key lessons that we've learned from working and tackling inequalities over many decades in our country and globally, we need to be applying them to COVID and doing them, you know, from day one, right? We don't have to discover inequalities with COVID because we know how to tackle it. So in the conversation today, we spoke about the importance of culturally competent programming, you know, making sure that language competency is there, that you have images that you use in your programs of people who reflect the population and the community, that we use ways of engaging with communities that matter to them, right? So using local community radio or social media, whatever works to engage with communities, that's important. Second, you know, making sure you have data. And Dale, it's amazing that something as understanding who's getting infected and why they're getting infected doesn't come easily when it comes to getting data for ethnic minorities and other domains of minority communities within our country, homelessness, LGBT communities, etc. So having good data. And then third, ensuring that you're delivering your programs and really looking at how you focus on reach and impact with those communities. So we learned from HIV that yes, you can set up HIV testing centers, but it really works well when you go into the bars and the clubs and you're able to go to community centers and engage people around testing and offer the testing right then and there. Vaccines, we know, work when you're able to get vaccines, not in big centers, but you go to mosques and you go to churches and you go to community centers and you knock on doors and you engage people and you speak to them, preferably with people from their own communities as well. So there's so much that we know. And sometimes I think in all of our responses, because we tend to want to do very structured programs for the general population, it means that some of the nuances and some of the ways in which you need to tailor programs to reach communities, we don't do that at the beginning. But I think COVID is teaching us that we do need to do that at the beginning, and we need to do that with communities as well.
So what have we learned? Same question again for you, Rageshri, about what we've learned from COVID that we can apply to, so what we've learned from other health inequalities that we can apply to COVID.
Again, I think as Kevin said, the importance of community engagement. I think, you know, we already had the skills there for some of the specific things to do with COVID. So for example, with partner notification, that's something that we've been doing for years in sexual health. So, you know, there's lots of lessons that we have there. So yeah, I think that's pretty much all I want to add to what Kevin said.
And then on the flip side, what have we learned about from COVID specifically that we can start applying to those other health inequalities, like you've listed earlier, like kidney disease, blood donation, or just organ donation in general, high blood pressure, those sort of things that affect Black and Brown communities more?
I think it's really highlighted that these inequalities exist, and I think it was something that perhaps not everyone knew about, and with COVID making it so clear, it's really got the conversation going. And I think some of the lessons we've also learned in terms of community engagement can be used going forward. So for example, some of the community centres, like using mosques or temples, for example, perhaps going forward from COVID, we can use them to engage with other health, in other health conditions as well. So I think that's going to be really important going forward.
Yeah.
Can I just add there, for myself, I'd not been involved in any patient participation programs at all. I didn't even know what PPV or PPI was, because I hadn't had a problem with my health. But now I've learned so much that actually this experience with COVID we can help our communities with a lot more things by just getting involved in the conversation from the start, from a policymaker's perspective, and not just be the patient for at the end receiving things, but actually be involved in the design of the guidance for the care and the support that patients may get for all kinds of things. Sickle cell, I mean, I'm going to get involved in so much more when I'm able I'm going to get involved in so much more that doesn't necessarily affect me personally, but it affects my community. But they need the right people to be talking and standing up for our communities in the right places. So that's something that I definitely have learned from this experience. I'll definitely take PPV or patient participation much more seriously, and not just on a personal level.
I think, Lisa, I agree. And I'm hoping that from this, we now have health champions in boroughs across the city who are engaging people on COVID and hopefully about health more generally. We have people who are chatting about health, about COVID, its impact, mental health in ways that we haven't done before. And I have to say, as a public health director for the city, I've had conversations, I think, with tens, if not hundreds of thousands of Londoners over the past 6 months about COVID, about the vaccine. And I'm hoping, Lisa, that arising from this is more activated communities and more engaged communities, and that we use this engagement to tackle the health issues that faces Black communities. So I don't want the conversation, the last conversation I have with the community to be about COVID. I want to switch to mental health next, to sexual health next, to heart disease next, and to have the same tough, difficult conversations again and again, because it's through these tough conversations that we really make progress. So I'm hoping that will be a legacy as well.
Absolutely, and that's also the purpose of the Black Health Matters project, looking at a number of different health inequalities that affect our community. COVID was kind of the prompt to really get it pushed now, because as you said, Rageshri, that it really highlighted all the existing inequalities more so than before. So yeah, Lisa, just a question. Just come up on the screen now. What tips would you give to people living with long COVID?
Oh, I wish I had the magic potion, Will. I really wish I do, because like this morning, I woke up, I felt fine, started working, I had loads of things to do, some spreadsheet work, and then I just got this pain, and then it just took me out, and I spent hours trying to call 111 and all sorts. So, main thing is listen to your body. If it's telling you to stop, stop and rest. Pace. There's something called your energy spoon. So like when you wake up in the morning, see how you feel. Don't plan to go and do your X, Y, and Z. You have to give yourself a bit of time to see how you feel, and as you start feeling better, continue to pace, because the relapse in nature does come with exertion. Most people have found, a lot of people try to exercise their way out of illness, and that's really common. When you've had the flu or something, you want to recondition yourself, you want to get back to yourself, but that's really been shown not to be the best kind of course of action for people with long COVID. Is that it can set you back, so you just have to take it really, really slow. There's a whole host of supplements that people are taking. It's not been proven whether they're helping people or not, so I won't recommend anything like that. But the main thing I would recommend is speak to others, join a support group. Some people find it's too much for them to speak out and put their own posts up, but just read other people's, or there's lots of materials now, lots more studies. So if you don't want to personalize it and put yourself forward, you can just read other people or read what the experts are saying about it. Because I found personally that keeping myself informed and speaking to other people that are going through the same thing has been such a comfort, because they know what you're going through. So just listen to your body, rest, and speak out, speak to others, because that's also good for your mental health as well. Trying to get through this on your own, or just trying to pretend it's not happening, is just, it's not good for anybody.
I'll echo the same.
I'm not a doctor, I should say.
I'll echo the same as you, Lisa. I've been dealing with long COVID now, the last 2-3 months? And there are days when I just feel completely burnt out. And I just have to say, okay, this is not the active day. This is the day you just rest and take it easy. Because as you said, when you start pushing yourself, overexerting yourself, that's when you feel the knock on in the next following day. So it's about just really listening to your body. And was respecting your body as well, not just, oh, well, I'm having a rough day, just going to push through it. Sometimes just, okay, body, it's time to just rest and relax. I completely agree.
And
so
just to say, I mean,
go on, sorry.
I was going to say, Lisa said that she's not a doctor, but she's living with long COVID, so she is therefore the expert because you are living with long COVID. So don't discount your experience at all. It's very, very important.
It's very true.
I wish my doctors felt the same way.
This past year has been really, really tough, not just for the UK as a whole, but particularly for Black and brown communities. As you mentioned at the very beginning, Kevin, COVID wasn't really a leveling, it wasn't really leveling the playing field. It kind of exacerbated existing health inequalities and highlighted ones that were already there. And we've seen that not only has COVID been a big issue for us in the past year, but we've also had the Black Lives Matter protests and the race and ethnic disparities report as well. We've been really resilient as Black and brown communities in dealing with this sort of thing. But it's taken a toll on us in both emotional and mental ways. Is there any tips from any of you in dealing with like the mental and emotional toll of COVID and all the other issues in the past?
I think something I talk to my patients about is what's controllable and what's not, because I think one thing about last year is the anxiety of not knowing what's going to happen, and there's various things that may happen that we can't control ourselves. So I talk to people like, can you control the controllable? So try and keep to your routines in your life. If you can, try and eat well. If you can, go for a walk or take some exercise. But also don't feel bad if you're not able to eat healthily every day because you feel like having some chocolate or whatever. And also, as Lisa said, the importance of really talking to other people. Don't stay isolated. There's lots of ways that we can talk to each other now, be it virtually or in person.
One of the things that has been really important for me, in addition to the sort of connecting with others, whether it's by phone, by Zoom, by WhatsApp, is just being physically active and keeping that rhythm of getting some physical activity in. And that's so important because we know physical activity is good for mental health. And in an environment where so much of what we're doing, for many of us, we're at home, we're on calls, our work pattern has changed in some way. Or maybe doing jobs that are under even more pressure and stress, finding that time to be physically active has been really important and has been a key part of my own personal resilience. But at the same time, also taking time to rest as well. And, as a leader, me saying to my team, listen, I'm going to take time off now because I've had an intense 3 or 4 weeks or 6 weeks. And I expect every one of you to be taking your time off and getting that rest, and switching off from the intensity of the pandemic has been critical. And I think that applies to all of us, no matter where we are. Finding that space to disconnect, to reconnect with nature, the things that make us happy, the people who make us happy, it has been a key part of my own sanity over the last year and a half.
Mm-hmm.
Yeah, I can only echo what I said earlier about just say things out loud, speak to people. If you've got problem, if you've got something on your mind, say it out loud, and more often than not, you'll feel better for it. Even if it's still a problem, at least you've shared it with somebody. So speak aloud. And if you're not sure about taking the vaccine, speak to others, speak to Kevin. There's things online now. Have the conversation with the people that are informed, and they're not going to judge you because it's a personal decision, and everyone's got the right to make their own mind up once they feel confident with it. You shouldn't be doing things under duress. So, but there are people that you can speak to that can help you to make the decision, rather than just feeling forced to not take it or forced to take it. So that speak, communicate. That would be my advice.
Thank you. And we've got a comment here for my mum, actually.
Oh.
She says, I'm not sure about taking the vaccine, and family and friends disagree with me taking it. What would you guys say to that? Although I have been pushing her to get the vaccine, but go on, guys.
I think Lisa hit the nail on the head, Penny. Get informed, ask questions. If you're really not sure, be specific about what you're not sure about and raise it with your GP, the practitioners at your GP practice, or search online specifically for the question. Because I find often people may have one or two things that are really at the back of their minds. Is it safe, or what's in it, or will it affect my, fertility, if or things, specific questions, and they can all be answered. And of course, because we're going to be opening up next week and everybody's looking forward to the next step of the roadmap, I really want everybody to be as well protected as you can be, so that whether you're in a pub or, hanging out with friends indoors, that you can do so safely and that you protect those around you as well. So that would be my encouragement for you, Penny.
Any comments from Lisa or Rageshri?
I'll just echo it. Yeah, I haven't got anything extra to say.
So I think we've met time now. Thank you, all three of you, for joining tonight. It's been really appreciated. You've shared so much and given so much knowledge on both COVID and how it's impacted our communities. Also, thank you, Lisa, for sharing your journey with COVID and long COVID.
Thank you for letting me have the opportunity.
Thank you. I'm going to let you guys go now, and then I'm just going to do the closing for the night. Thank you again.
Okay, thank you.
Thank you. Bye, everybody.
Bye-bye.
Bye.
Pleasure meeting you.
Thank you all for coming. It's been a great night. It's been an absolutely amazing night. As I said, we've learned so much from Kevin, from Rageshri, and from Lisa on both their personal experiences with COVID and professionally. If you would like to learn more about COVID, please go onto the NHS website about COVID-19. My colleagues that are working in the back will put it on the screen now. Thank you. If you want to find out more about the Black Health Matters project, where we'll be tackling further health issues, such as kidney disease, high blood pressure, donations on like organ donation, that sort of things, please visit our website now on the screen, the Black Health Matters. On our website, you can also read our blogs about what Black Health Matters is about, and we'll have future blogs come up as well. If you would like if you want to contact us directly and see how you can get involved with Black Health Matters, feel free to email us on bhm@thelovetank.info. And yeah, I think that's it. Thank you again for all coming tonight. And I hope you have a good night. Thank you.